Welcome to another episode of Coco and Teal Speech Therapy. I'm Teal, this is Coco. Today's video is a public service announcement / reminder on the importance of hearing screenings between the ages of 0 and 3 years. Hearing screenings are usually accomplished at the hospital after birth and before parents and baby are discharged. But if you can't find this paperwork, sometimes it occurs that the hospital staff doesn't have time or forgets to do a hearing screening, and just make sure you follow up with the hospital or ask your pediatrician to complete a hearing screening at your next appointment. If your child isn't hearing all the sounds of speech as well as just environmental noises and sounds around them in their environment, they're probably not going to develop speech and language along a typical timeline. Checking a baby's hearing is quick and painless for you, the provider, and the baby. Most places will use what's called an OAE or otoacoustic emissions machine, which simply requires that the technician plug in a small earbud to one ear and then the other. This earbud pings sound into the inner ear, and depending on how that sound is returned through an echo back into the machine determines what frequencies, high, medium, or low, your baby might be missing out on. So the test takes less than 30 seconds per ear, and it can even be done while your child is asleep. Right now, during COVID, we are facing an issue because we're not actually able to visit families and children in person, and this is not a hearing screening that can be accomplished over Zoom. It is a visit that you'll have to figure out how to make safely in person with your pediatrician. If you have any concerns with your baby's hearing, I strongly urge you to make this in-person appointment if it is at all possible, and take the utmost precautions during your visit to the doctor's office. But how a baby is hearing and understanding language can set them way back at this age. If there is some kind of issue with their hearing, we want to take care of it right away. Besides the hearing screening provided at birth, I recommend screening your baby at 6-month intervals until they turn 3 years old. During COVID times, this might be a little bit extreme, and if you really don't have concerns with your child's hearing, speech, or language, then we could push this to a year or longer between screenings. But if your child does have a speech language delay, history of hearing loss, or you have this feeling in your gut like they're not responding to sounds and words the way I would expect them to, I urge you to check this off your list every 6 months and make sure that this isn't the cause of your child's speech and language delay. Most of the hearing loss in the 0 to 3 population is what we call conductive hearing loss. This is when a child is having frequent ear infections or a lot of earwax, which is actually building up in the canal and making it hard for sound to get through. So this conductive hearing loss is easily treated either by frequent and thorough cleaning of the ears, or in some cases they will insert PE tubes, which actually provide a hole in the eardrum for the fluid to drain out of the middle ear. Something I recommend parents to focus on if they are suspicious of hearing loss in their child, or if they know that their child has some degree of hearing loss, is to really focus on visual aspects of language. This could mean teaching and learning yourself baby sign language to use with your child. If your child isn't learning to speak at the typical milestones, ideally we could teach them some signs so that they're more or less keeping up with their peers using visual language rather than verbal language. As always, I recommend hooking up with an early intervention agency in your area if you have concerns about any area of your child's development. Thank you for watching another episode of Coco and Teal Speech Therapy. See you next week.